Nurturing care, nutrition, health, responsive care, early learning, safety and security. The foundation for children's development. Cost of inaction. About 250 million children under 5 are at risk of not reaching their full potential. About 25% reduction in average adult earning potential. Countries may lose up to 2- or 3-fold what they now invest in health or education. Early childhood development pays off. For governments, the return of investment in early childhood development interventions can be between 7 and 13%. The human returns on the investment are substantial and intergenerational. Better health and learning capacity. Reduced crime rates. Higher individual adult income. Better equipped workforces. Nurturing care means supporting parents and caregivers to breastfeed and provide nutritious food. Maintain good health during conception, pregnancy, and in the postnatal period. Provide a nurturing and safe environment. Give their children opportunities to explore and learn.
Hello, good morning, good afternoon, good evening, everyone. Thank you all for joining this webinar. I'm Evelyn Santiago, the Executive Director of the ARNEC Secretariat. It is my pleasure to welcome all of you to this webinar featuring the Early Childhood Development Service Quality Standards for South Asia. We will look at how these standards can be applied not just in South Asia, but also in the whole Asia-Pacific region. The development of these standards was supported by UNICEF, specifically the Regional Office for South Asia. ARNEC was part of the advisory group who provided inputs as the standards were being developed under the leadership of Dr. Vinita Cole. As some of you would know, UNICEF was one of the founding members of ARNEC back in 2008. It was instrumental in the network's development and growth. Through the years, we have been partnering with UNICEF on initiatives that aim to support the promotion of quality ECD in the region. We have been promoting an integrated and multi-sectoral approach to ECD with the 5 elements of nurturing care as our main framework. Today, as we share the ECD service quality standards, we will again be seeing a resource whose content is aligned with our advocacy for a holistic and inclusive approach to ECD. We are grateful to UNICEF ROSA for developing this important resource. For this webinar, we have the following objectives. Next slide, Rowan. First is to introduce the ECD service quality standards and basically looking at its content, the guiding principles, the domains, and specific standards for each age group. Second is to reinforce how the standards can be applied, especially in the context of COVID-19, where a blended approach to delivering ECD services is quite common. Third is to facilitate a discussion with our ECD experts and practitioners from the region on how the standards can be adopted. And finally, we hope to encourage countries to think about how to apply these standards given their own context and specifications for quality. Today's webinar will be moderated by Ms. Mita Gupta. Next slide, please. Mita is the Early Childhood Development Specialist and Disability Inclusive Education Focal Point at UNICEF ROSA. She supports the promotion of ECD and inclusive education in the South Asia region. We are also pleased that we have with us today Dr. Jim Akers, who is the Regional Education Advisor at the UNICEF Regional Office for South Asia. He is also the co-chair of the Education 2030 Plus Technical Working Group together with UNICEF East Asia and the Pacific Regional Office, and UNICEF and UNESCO Bangkok. Jim will be speaking to us on the ECD status in South Asia and the link to the ECD service quality standards. Thank you, Jim, for joining us, and you now have the floor.
Yeah, thank you very much. Can you hear me?
Very well.
Okay, great. Yeah, dear colleagues and friends, it's a real honor and pleasure to be able to make these welcome remarks today. ARNEC has been a close friend and ally of UNICEF for many years, as we've just heard. It's one of the key networks which provides impetus to the Education 2030 Plus Technical Working Group for Asia and the Pacific, which I co-chair. And I think it's possibly the most important and largest ECD network in the world. So congratulations to ARNEC for the growth that you've shown since your inception in the early 2000s. Early childhood is considered the most important phase in life in many ways, in that it lays the foundation for physical, emotional, and intellectual well-being. As evidence shows, what happens to a child during this period can determine their developmental trajectory throughout their lives. So the early years, and when we need to address the early years are the stage at which we need to address inherited inequalities at birth and to level the playing field before, for example, children start in mainstream schools, in primary schools, for example. So while parents and caregivers have an important role to play in their young children's development, governments will remain the principal duty bearer. They have the key responsibility in ensuring quality essential services. It's perhaps the best investment they can make to break the vicious cycle of intergenerational poverty and deprivation and to promote social equity and prosperity, particularly in these post-COVID days. So countries in the region have been placing an increased priority on ECD, but typically ECD services involve multiple stakeholders and quite often they're unregulated and without minimum quality standards to guide them based on the developmental needs of young children. Indeed, many young children still remain excluded from the playing field in terms of access to essential services, and the equity gap is of critical concern. Data in the region are limited, but based on those available, it appears that 42% of children in the region are at risk of impaired development. That's very serious. That's close to half the children. The region is home also to 40% of the world's stunted children, with 56 million children under the age of 5 in the region suffering from stunted growth and development. According to the latest available estimates, pre-COVID, 57,000 mothers die annually, which is a maternal mortality rate of 163 per 100,000 live births, which is unacceptably high. With regard to early childhood education, access continues to be a critical issue across many countries, with enrollment rates in pre-primary education under 50% in several countries, not to mention the issue of the quality of early learning across the countries. As you know, COVID-19 has led to interruptions in essential services for young children, and early childhood development is likely to see further setbacks. Due to the COVID-19 pandemic and related school closures, 22 million children missed out on their critical preschool year this year in 2020, with most countries' governments focusing on reopening at higher grades first, where really the face-to-face contact is most important for the youngest children. According to our own analysis at UNICEF Rosa, maternal mortality may have increased by 16% and under 5 mortality by 11% in 2020 due to reductions in essential service coverage. If so, mortality rates in 2020 are likely to be close to those in 2015. So we will be losing a lot of the gains over the last 5 years. Research by the Standing Together for Nutrition Consortium estimated an increase of 3.9 million children under 5 suffering from child wasting living in South Asia due to the pandemic. At the same time, the COVID response has seen increased attention to parenting education, which is most welcome and must be sustained. So we must also look at the opportunities that have been offered by the COVID response in terms of creativity. Thus, ensuring that essential services for young children and parents and caregivers are available and of good quality is critical now if children are to fulfill their right to optimal development. The rationale for UNICEF Rosa's work on ECD service quality standards was very strong pre-COVID. It is even more imperative now as we try to mitigate the effects of COVID. I hope you will find the standards and guidelines useful in promoting the provision of holistic and comprehensive quality ECD services, either through developing new national standards or through strengthening existing standards. Thank you so much for joining the session today. I hope you have a very fruitful discussion which leads to positive actions to ensure equitable access to quality early childhood development. Many thanks.
Thank you, Jim, for your very informative remarks and for reinforcing the importance of ECD, especially at this time of the pandemic, and the importance of having standards to guide the ECD programs, especially because it is multi-sectoral in nature and involves a lot of stakeholders. So with that, I now give the floor to Mita, who will be moderating the rest of the session today. Mita, over to you.
Right, thank you so much, Evelyn, and thank you also from my side, Jim, for setting the stage for our session and our discussions today. And hello, everyone, and thank you for joining us for this webinar on the ECD service quality standards. Before we get started with the main part of the program, I just wanted to go over a few announcements with you. So one is to note that this webinar is being recorded, and the recording and the PowerPoint that will be made later in the session will be available on ARNEC's website afterwards, so you'll be able to find everything there. We really would like to hear from all of you, so please do use the question and answer feature that you'll see towards the bottom of your screen. You'll see where it says Q&A. To pose any questions that you might have for our speakers today. And if you see a question there that someone else has posed that you're also interested in, you can vote for that question by clicking on the thumbs up option, thumbs up icon, I'm sorry, and we'll try to get to as many of your questions as possible by the end of the session today. Right, and we encourage you to join ARNEC as a member to stay informed about upcoming webinars. And you can do that by going to arnec.net/signup. And you can also like and follow ARNEC on Facebook to get regular updates. And we'd also like to request your feedback on this webinar and would really appreciate if you could take a little bit of time and complete a short survey at the end of the session today. And we'll be sharing a link for that at that time. And for those of you who don't have time to do that right then, we'll also be sharing the link for the survey afterwards. All right. So now to get to the main part of the session, if we could go to the next slide. So over the course of the session today, we'll be focusing on these three key questions. First, we'll be looking at why is there a need for ECD service quality standards? So why are these standards important? We'll also be discussing what these service quality standards are and who can use them. And lastly, and also importantly, we'll be looking at how these standards can actually be used. And as was mentioned earlier, we'll be hearing from ECD experts and practitioners to get their perspectives based on their experience and expertise on how these standards can be applied in different contexts. Right. And we're very fortunate to have, if we could go to the next slide, we're very fortunate to have with us an eminent group of speakers who bring with them a wealth of knowledge, experience, and expertise in early childhood development. And I would like to invite them to please introduce themselves to all of you, starting with Dr. Vinita Cole, who developed the ECD service quality standards. And we'll be introducing them to us shortly. So Vinita, I'd like to ask if you could turn on your video camera and introduce yourself, please.
Good morning, and thank you, Meeta. Good morning to everyone. Good morning, good afternoon, good evening. My name is Vinita Cole, and I'm currently designated as Professor Emerita from Ambedkar University, Delhi, from which I retired about a few years back, and was also the founder director of the Center for Early Childhood Education and Development at the university and the chairperson of their advisory committee.
Thank you so much, Vinita. Good to have you with us. Next, we have Dr. Sheldon Schaefer. Sheldon, if you could kindly introduce yourself.
Well, thank you. I'm currently chair of the board of directors of ARNEC, and formerly I was chief of UNICEF's Global Education Program in New York, and also director of UNESCO's Asia and Pacific Regional Bureau for Education. Thank you.
Thank you, Sheldon. And next we have with us Mamuda Akhter. Mamuda, if you could kindly introduce yourself, please, and turn on your camera.
Hi, I'm Mamuda, working for Executive Director of Institute of Child and Human Development, and also the Vice Chair of Bangladesh ECD Network since last 2 years. And I have very good involvement with ARNEC since 2008. Thank you, everyone.
Thank you so much, Mamuda. And last but not least, we have with us Sumitra Mishra. Sumitra, if you could kindly introduce yourself.
Hi, good morning, good afternoon, good evening, everyone. I'm Sumitra. I work as the Executive Director of Mobile Creches here in India, out of Delhi. And Mobile Creches runs and operates creches and daycare services for children between 6 months to 6 years, sometimes going up to 12 years across some of the most vulnerable sites, such as constructions, prison, brick kilns, and so forth. Looking forward to speaking to all of you.
Thank you so much for that, Sumitra, and thank you, everyone. And we look forward to hearing from all of you. We'll now go to our first presentation of the ECD quality, service quality standards. But before I hand things over to Vinita, I just wanted to just quickly note that we will pause for questions after this presentation. So please do add any questions that you might have in the Q&A feature as mentioned before, and we'll address the questions when at the end of the presentation. So over to you, Vinita, please, for your presentation.
Thank you, Meeta. I would just, first of all, I would like to thank ARNEC and UNICEF for giving me this opportunity to present and to be able to be engaged with the preparation of these standards. So what I would be doing in this presentation is to respond to the questions, the objectives of the seminar that, and the questions that Meeta had shared with us, the 3 major questions of what, why, and how. I will be introducing the ECD standards that are there. If you notice, the title of this document of standards is Building Futures, and that is very representative of the video that we saw earlier and what Dr. Jim Acker talked about, the importance of early childhood education and really determining almost the future of a child's life. And therefore, the significance of ensuring quality at this early years for every child in our respective countries. What the presentation would focus on introducing this document, what it looks like, the structure, the context for the standards, guiding principles and standards, guiding principles that have informed the standards, and what are the quality assurance and monitoring systems advocated for ensuring that the standards reach where they need to, and creating a very enabling and supportive policy environment for the standards. So this is the scope of this presentation. Before I get into the actual standards, I would just like to share with you that this has been prepared through a very intensive process of participation. It was done in 2 phases. Initially with a review of standards from 8 countries, which included countries within South Asia as well as outside of South Asia, as well as very in-depth case studies that were developed for India, Sri Lanka, and Thailand to be able to get a real understanding of what the quality issues are in the context of South Asia, as well as what are some good practices. There was also a review of the global guidance documents like the Nurturing Care Framework, UNICEF's programming guidelines, and other such documents. And also a peer group was constituted for this purpose from across countries, not only within South Asia, but also outside and from other international organizations who periodically helped, who were consulted periodically and who helped to review the document at various stages of its preparation. And then the phase 2 was actually based upon the work of the output of phase 1, prepared the standards, which were again gone through with a lot of peer group review and consultation, as well as a review workshop, which was extremely useful, which was held, I think, in November 2019, with South Asian counterparts from different countries within South Asia, which really did a 3-day intensive review of the draft. And on the basis of this entire work, the document was finalized. So in terms of the structure of the document, what it looks like is that it has 3 parts to it. The first part actually talks about the significance and priority. The second is the substantive part, which actually goes into what are the services, the different classification of services, and what are the corresponding service standards that are proposed. And the third part is what the use of the standards. Next, please. So what do we mean by ECD services? Because I think it's very important to define what do we mean by an ECD service, because there are various multiple dimensions to it. The way we define it for the purpose of this document is that any ECD service is a community-based intervention, either center-based or home-based, that supports the needs of pregnant and lactating women, infants, and or young children, and are vital for their early childhood development. I would like to point out that unlike the standards that we reviewed, which were largely related to education or early learning, or there were the WHO standards which were focused on health, this is, I think, perhaps one of the first few efforts to bring in an integrated set of standards which look at the integrated development of children at every sub-stage. So this is why we are looking at it from the pregnant woman as well as the younger child in terms of their learning and development. The scope includes services sponsored by any sector, so it could be sponsored by health, nutrition, education, sanitation, rural development, and it could also be a public venture, it could be a private or a community-based venture. It can also be any program provision that is either single window approach, like in India, we have the integrated child development services, or it could be multiple windows, but complementary to each other. And another set of classifications, which is very important to note it could also be either universal support services, targeted or indicative. Universal meaning something that is available to all children, for example, an education program or an immunization program. It could also be targeted in form of, for example, special services for children with severe malnutrition, or indicative support services which are suggested to individual children, for example, especially with special needs, for example, physiotherapy or speech therapy and so on. Next, please. So the categorization that we've done, we have gone into 3 sub-stages in the preparation of these standards. The standards for prenatal to birth, that means from conception to birth, from birth to 3 years, and from 3 to 6 years. 3 years to school going age, school entry age, because we did not want to define 6 years because it was it varies from country to country, and within India it varies from state to state also. So we set 3 years to the school entry age. And within each of these substages, we have the two categories of home-based and center-based. And these standards that are proposed are covering the 5 domains that were shown so beautifully in the video earlier, that are the nurturing care domains of responsive care, health, nutrition, early learning, safety, and security. So in terms of what are those kind of services, what do they look like on the ground? The center-based services, as we know, are creches, daycare centers, nutrition rehabilitation centers, health facilities, preschools, some destitute care facilities, etc. And the home-based would be programs like the parenting programs, volunteer-based outreach to families, nutrition programs, health campaigns, creches run by mothers groups, and so on. So there can be various versions of it within each country. Next, please. Important, this question that Meeta raised was, why should establishing these or contextualizing these service standards be a priority for every country? As Dr. Jim Akhter very nicely said, the early years are very significant. The environment matters. Not only are they significant in themselves, but the kind of environment that the children get is very important. ECD participation can have long-term impact almost into the adulthood. The quality is key to ensuring this the positive impact, because it's not that any kind of experience would help, but good quality is highly important as evidenced from research. Therefore, early spending on early childhood development makes for a very sound investment. And keeping this in mind, we should also keep in mind what Dr. Jim Akhter said, that 250 million children around the world are actually not learning or developing at their full potential. And almost 42% in South Asia are not developing at their potential. So that's a matter of concern. So it's very obvious that we need to do much more in early childhood development. Plus, there is also the commitment by all countries to Sustainable Development Goals, Goal 4.2 in particular, which makes the countries commit to ensuring good quality, high quality early childhood development opportunities for all children, and at least 1 year of pre-primary education for all children as a preparation for primary schooling. So keeping this kind of commitment and significance in mind, it is very important for each country to really look at these standards very carefully and facilitate children's development by actually working on contextualization and adaptation as required for each country. How will these standards help? They help by providing guidance for planning, implementation, monitoring, evaluation of the programs that are there on the ground. And also, in our course of our review, we found that most of the countries in South Asia have developed the early learning development standards, as well as have policies for early childhood development. And therefore, this helps to translate those standards and policies into action for ensuring quality. And these can be all seen as a package which needs to be referred to as we work towards planning for early childhood development. Next, please. Who all can use the standards? The potential users are policymakers, planners, development partners, implementing organizations, entrepreneurs, service providers, parents, caregivers, community members, and also for research, program evaluation, and monitoring. How will they really help is because all these stakeholders for early childhood development need to have a common vision for early childhood development, which is not there at the moment. And therefore, it's very important to have these standards available to everyone to be able to develop that collective vision, enable planners and service providers to design, monitor age-appropriate and quality provisions, enable caregivers to not only provide for their children and support through responsive care and nurturing care, but also make informed choices in terms of the programs and provisions that they are selecting for their children. Ensure effective monitoring, mentoring, supervision, and evaluation of the programs. So at each stage of a program implementation, these would be very, very useful, and provide a framework for research as well to be able to improve further on quality. Next, please. If you see how we've developed these standards, so essentially we start with some guiding principles, 8 guiding principles, which are like what are the typical motherhood principles that are universally accepted, move into domain-wise priorities, the 5 domains that we've been talking about, because those have some specific concerns that need to be kept in mind. So these are generic. And then we move into the stage-wise service standards for each of the 3 stages that I talked about, which are again classified into home and center-based programs. And with each stage, this is a format that is there in the WHO standards, which was adopted for this these standards as well. That was WHO one was for the health only, where we have a quality, where we have a standard statement. And for each standard statement, there are some quality statements for which kind of give the which help to operationalize the implementation of that standard. And then we have indicators for specific measurable indicators for monitoring or for planning as well as for monitoring for each of the categories. Next, please. So the 8 guiding principles, I would like to just say briefly, I don't want to get into the reading it all. The first, just to get a sense of it, equity, inclusion, and acceptance of diversity. The right of every child to survive, grow, and thrive is there. We must acknowledge that. The approach to these standards is to have a rights-based approach and not a welfare-based approach, which we are very used to, where anything will work in terms of provisions. So the rights-based brings in accountability and quality. It is important to recognize that this good quality can break the cycle of intergenerational poverty. We must acknowledge and respect the role that parents, families as primary caregivers play in the life of a child, and build on that. Incorporate state-of-the-art knowledge, but also bring in the national and local cultural ethos into our planning and implementation, and also be very sensitive to the context as well as the cultural sensitivity needs to be there. Next, please. Then we have these domain-specific, keeping the 5 domains in mind, some specific considerations. Again, I will not go into this detail because I don't have the time. But as you can see, the first 3 are related to health, which are very specific. I'll just give you one sense of it. Healthy development means children of all abilities, including special healthcare needs, are able to grow up in an environment in which their physical, social, emotional, and learning needs are being met. So again, the effort is in each of these domains also to bring in the holistic approach to the child's development and not just specific to each domain in a narrow sense. Then we have another set of them for nutrition. Next, please. Then we have for responsive caregiving. For example, responsive, one of the ones that I just read out is, while custodial care is important for the protection of the child, responsive care is significant for the child's holistic development. And the first one, responsive caregiving, encompasses sensitivity and responsiveness. Sensitivity is being aware of the child's acts and vocalizations from birth. Responsiveness is the capacity of the caregiver to respond appropriately to these signals. So those kind of directional statements are there. The next set is on early learning, which talks about learning begins at conception, and talking with the baby in utero helps the fetus to recognize a mother's voice later after birth and bond better with her. And it can even impact child's speech and language development. So these are kind of new learnings that are also there, which are being introduced through these statements. Next, please. Safety and security, again, this is a very important domain. And so again, this is talking about every child must be protected from abuse, violence, neglect, and harm by ensuring measures and appropriate practices for prevention and intervention. And it also talks about, for example, children are becoming victims of emergency situations in countries around the world, which can create toxic stress and have serious consequences for physical and emotional development, health, often leading to social maladjustment. So these are things that we need to be keeping in mind as we plan and implement programs for children. Next, please. So I then come to the standards. Again, as I said, these standards are statements of standards, and then there are certain quality statements which follow each of these standards. what we have done here is that the health standards are already accepted across South Asia. The WHO standards, sorry, are accepted across South Asia for health. And therefore, we have given the required links, given the necessary information, and just picked up the standards, but not got into the detail because it is already available. But for the other domains, we have actually prepared standards which are corresponding to the same format. So these are these 8 standards for conception to childhood. I would not like to read them again because the time is not there. But I think I'll just take a couple of them just to give you a sense of what they are. Communication with women and their families is effective and in response to their needs and preferences. So this is a standard that in a particular program, the communication approach or the communication that is being done with the women and their families is not only effective, but is also in response to their needs, preferences, and contexts. Or if we take another one which says every woman and her family are provided with emotional support that is sensitive to their needs and conditions. So this way, again, you see that integration coming in. It is not just about the physical health of the child or the mother, but it is also about her emotional and holistic health. Next, please. Then we have childbirth to 3 years, which is again separated into home-based and center-based. So again, this is a set of statements, the standard statements, which are, for example, I'll take the second one. Every child is given holistic and age-appropriate opportunities for his or her development and sorry, I'm missing the word there. Development and irrespective of the child's caste, socioeconomic status, gender, language ability, and social context. So again, the need for universal and equitable treatment for all children. Every child's safety and security, physical and socio-emotional, is considered paramount in the efforts towards ensuring children's development, and all precautions are taken to create conditions that will ensure the same. So last one, for example, competent, professionally trained and motivated service providers are available to identify and to plan for and address needs of each child by supporting the parents or family as caregivers as and when required through home visits or through community-based interventions. So these are like very specific for this particular age group for home-based programs. Next, please. Similarly, for center-based services, those are more customized for the center-based approach, where again, these are the standards that are there, where, for example, it says that competent, professionally trained and motivated service providers are available to identify and address the needs of each child in the center, or every parent or family is given guidance and support in responsive caregiving and parenting that strengthens parental capabilities to meet the holistic needs of their children by complementing the center's curriculum and retaining sensitivity to the parents' own needs and sociocultural context and their role as primary caregivers. So it is again catering to the situation which is there in the programs, like we call the playgroup programs or even the health immunization programs for the younger child. Next, please. Similarly, we have the service standards for 3 years to school entry. Here we got into a bit of a debate because we realized that we wanted to do it for home-based programs as well as center-based programs. But we realized that there is a commitment from the SDG to have some kind of organized pre-primary education for children, at least 1 year of it. And therefore that kind of sets a standard or a benchmark. And therefore what is valued apparently internationally is a more organized center-based program. So we have not got into the home-based so much in this, but the services standards for 3 years to school entry, which again relate largely to the quality of the kind of program in terms of curriculum, pedagogy, infrastructure, and so on. So I think we would be more familiar with these kind of standards. For example, I just read one which says every parent family is given guidance and support in responsive caregiving and parenting that strengthens their capabilities. Another one says competent, professionally trained and motivated service providers, teachers are available to identify and address the holistic needs of each child. Another one says, every child's health and nutrition is nurtured through periodic health checkups and immunization, age-appropriate and safe complementary foods, age-appropriate pedagogy, safe complementary foods, promotional nutritional supplementation, and so on, growth and regular growth monitoring. So all these, again, for every preschool program, one would say, needs to have this kind of a holistic facilities for children's development. Next, please. And then for each of the substages, I'm not going into each of the substages, but overall for each of the 3 substages, we have the indicators for quality monitoring, which can be converted into any instrument or any kind of a tool for quality monitoring or planning. These address the quality in terms of structural quality, process quality, and outcomes in the domains, in the 5 domains. And as you can see, the structural relates to dosage, which means, in other words, how much of the program provision is available to the child. For example, how many hours does the child spend in a preschool, or how many the immunization schedule of a child, and or visits to the homes or whatever. How much of the temporal aspect of it, the physical space and facilities available to the child, and the staffing that is available in terms of ratio, adult-child ratio. Process of the quality processes get addressed by in terms of the curriculum, the domains covered, age appropriateness, sensitivity to parents, technical knowledge of the providers, and parent satisfaction level. And outcomes are in terms of the 5 domains again. Next, please. Then creating an enabling environment for high quality early childhood development. The biggest challenge that we find in early childhood development is that it is operationalized or implemented by multiple sectors, and largely the health, nutrition, and health, women, and education sectors. And therefore, there's very little convergence across these. Even the policies we find across the countries are unisectoral, and therefore what it recommends is an autonomous authority, an approved multi-sectoral policy, a multi-sectoral plan, so that the different ministries or departments come together and plan for it and operationalize it, and some sort of systematic mechanism for convergence and coordination, and also a cadre of very well-trained, professionally qualified providers, service providers, so that quality can be maintained, for which, again, there should be a backup of professional institutions, decentralized provisions for parental support, and system of regulation of quality assurance and regulation. Next, please. The quality, can we just go to the last, since I'm running out of time? Yeah, this one. So if you can see, you were seeing that Singapore Spark model. So something similar to that, what is envisaged is that there should be an enabling come enforcing framework. Normally, when we talk about quality monitoring, we talk about licensing and a very punitive approach. What is mentioned here is an enabling come enforcing, so that there is some sort of self-assessment based accreditation system within which the system can not only conceptualize what quality is and communicates that to all the stakeholders, but also is available to make assessments, but also is able to handhold and provide for quality promotion and improvement in the programs provisions that are there. So it is a very holistic quality accreditation system that is envisaged. And next one, please, the last one. So when we are saying that these standards are very, very significant today, especially because of the COVID-19 experience, I would basically like to say that somewhere what our year of COVID has shown us is that all early childhood development services need to be categorized as, especially in health and nutrition, need to be categorized as essential services, because we've seen a lot of disruption and the negative impact it has had on children's development as a result of COVID or any such disaster or calamity that may come later. Parenting has emerged as a very vital resource through this year's experience. But what is important is for us to consider how can responsive and positive parenting practices be strengthened while also taking into account that there is a lot of additional parental burden of childcare, which comes in along with this kind of a situation, which as we've seen has led to a lot of even domestic violence or child abuse or corporal punishment. Then we talked about online and blended learning as becoming the mode for the future, but is it really conducive for early childhood years in terms of child's holistic development? Can that promote children's socio-emotional development, for instance, or their language development? And all these aspects we really need to consider to add on to, because these standards were done pre-COVID. So it is important to add on these aspects by thinking about these and bringing in some additional aspects in the standards to be able to address and make them much more responsive to the current situation. Thank you very much, Meeta.
Thank you so much for that, Vinita. I know that was a lot to cover, but thank you for that comprehensive presentation of the standards. And also, emphasizing this, importance of these standards in the, including in the current context, or even more important in the current context. Maybe we could pause for maybe one question, and then we'll also have a chance to come back to you with questions also as we go along. But one of the questions that's coming up quite a lot is about contextualization. And also, as we're talking about these as standards for South Asia, and one of the questions that's coming up is, what are the considerations that need to be borne in mind in terms of contextualizing and using these standards in different cultural and other contexts? So if you could kindly speak to that.
Yes, I think that that's a very important question. Basically, there are certain basic principles, guiding principles are given, these statements are given, which are fairly generic, and they need to be translated, and the indicators also are fairly generic. They need to be translated into the specific country situations, or not even within country. Sometimes there may be diversity within the country as well. So they need to take into account the socio-cultural aspects of the actual location where they are, for which they are going to be adapted or contextualized. They need to be take into account the resources that are available for ensuring quality. They need to also take into account the kind of personnel that are available. What is a kind of a baseline and where we want to move with it. So there has to be a country-wide vision for it, which should determine how they will plan to be able to move in that direction, because it cannot be something very immediately transformational. So it has to be planned and worked towards. So the most important thing is to think in terms of developing a cadre of people, professional people at various levels of implementation, who will be able to really translate these standards into the contextual realities that are there, and be able to then make provisions which are very conducive for development and growth of all children. So that is very important. So language becomes an important factor. The socio-cultural elements, the education levels of the community, mother's education in particular, is a very, very important aspect which we need to look into.
Right. Thank you so much, Vinita. And maybe I will ask you one more question just real quickly, and we'll move on to the next segment. As we're looking at this overall, set of standards, and one of the questions is also coming up in terms of how to implement this, including in low resource settings. Are there standards from amongst these that you would say are, non-negotiable standards, or how can countries sort of approach that or identify those? If you could, let us know your thoughts on that.
Actually, as I said, the standard statements are very generic, and they are non-negotiable. For example, because they are talking about the processes more than the actual inputs and facilities. But when we come to the indicators, that was one of the concerns we had, that you cannot prescribe anything. You cannot say a ratio, for example, an adult-child ratio of 1:20 or 1:15, because every country has a different situation. And therefore, so the aspects to be kept in mind are non-negotiable. So you need to have a good optimal adult-child ratio, but exactly what it should be has to be left to a particular situation or context in terms of resources and availability. So that I think is important. Yeah.
All right. Thank you so much, Vinita. I'm sorry.
Thank you very much for the opportunity.
Thank you. Thank you so much. And we will come back to you, Vinita, in the next segment as well, when we'll pause for questions and answers. Our next segment of the program, where we'll be focusing even more on the whole question of how, so how can these standards be used and applied in different contexts? And for this, we'll be hearing from a panel of experts and practitioners, starting with Sheldon Schwartz, who'll be talking about the overall importance of having these standards and also how they can be used in this current context of new learning approaches and the blended learning approaches in the context of COVID-19. And then we'll be hearing from Mamuda Akhter from her perspective as from the Bangladesh ECD network on how these standards can potentially be adapted, used, and promoted in the context of Bangladesh. And then we'll go to Sumitra Mishra, who will be talking from the perspective of mobile creches, key NGO working on ECD in India, on their experience in adopting similar standards and what the lessons learned have been from that experience. With that, I'll again just remind everyone we'll be stopping for questions again after this segment. So please do keep your questions coming, and we'll try to get to as many of those as we can in the next round of questions. All right, so with that, I would like to invite Sheldon to please make your remarks.
I'd like to make. One is that clearly ECD service quality standards are an essential component of what is required to support equitable access to high quality ECD services and to lead to the holistic development of young children. I think there are probably 5 essential components to achieve this outcome. You have, first of all, a definition of the holistic outcomes that you want for children, whether it's early learning and development, linked to health, nutrition, cognitive linguistic development, protection. You also have, especially for supporting early learning, some kind of a curriculum with supporting activities in order to achieve these outcomes that you wish to have. But then you also need to have defined caregiver or teacher competencies needed to deliver this curriculum. But then you also need appropriate training in order to ensure that the teachers and the facilitators gain these necessary competencies. And finally, but equally important, is this question of the service quality standards, which define what an ECD service should, in a sense, look like in order to assist teachers and others to deliver the curriculum needed to obtain the desired outcomes. Secondly, it's important to have, as has been pointed out above earlier, service standards for early childhood development as a whole, and not just for early learning. In fact, the service standards developed by UNICEF Rosa, anchored on the 5 elements of nurturing care, is an excellent step in this direction. In fact, COVID-19 has reinforced this need for a blended approach to ECD in terms of integrated services. Some countries in the region, in fact, have adapted to this issue of integrated services quickly. For example, health and nutrition programs becoming more integrated with, rather than separate from, pre-primary education programs, or early stimulation and responsive care integrated into everyday caregiver activities delivered through remote parenting programs. In recognition of this more blended approach to ECD, current standards therefore must be adapted so that they will support the design and implementation of more integrated and better coordinated and convergent services. Third, an example, going back to blended learning. We used to think that we knew how to best promote early learning, a model based on play-based interactive approaches, peer learning, use of mother tongue, focus on social emotional learning and initial early literacy, all in a healthy, hygienic, protective, and responsive nurturing environment. But COVID has in fact demanded adaptation of this model of good early learning practices to the context of blended learning. So there need to be different standards, even more linked to the context of the home, of the family, and the larger environment. For example, in a given context, what standards should describe, in the time of COVID, the best balance of individual online, family-based, and face-to-face activities. Again, this will differ per context, but the standard would be useful to have. What standards are needed, for example, on the accessibility to necessary blended learning tools? For example, minimum requirements for IT provision. Or what standards are needed on the quality of what is provided to young children online or through home delivered learning packages? For example, should they be in mother tongue? Should they be able somehow to be delivered by even illiterate caregivers? Conclusion, we need to rethink, reformulate, perhaps develop additional quality service standards suitable to this era of blended learning and more generally blended approaches to ECD. Fourth, the final comment, these new standards exist in a sense as if they were in a vacuum. They don't seem to lead to future outcomes or contexts. They cover conception to birth, birth to 3, 3 to entry to school, but in fact, where are the standards for 6 to 8 and for transition, which are also essential stages of early childhood development? So should there not be standards somehow related, for example, to the readiness of children for school? What standards should there be in relation to the kind of early childhood development curriculum, pedagogy, assessment methods, and teacher training needed to help children get ready for more formal schooling? Or do we simply assume somehow that services which meet our 0 to 6 standards will automatically ensure such readiness? I think not. Perhaps also standards about readiness of the schools for children. What standards are needed in the early grades of primary school, which link back into those pre-primary programs in order to ease a child's transition to the early grades from an ECD program or from home? Perhaps this is outside the remit of the standards being discussed today, but one implication of this comment is that one important audience or user of these standards should in fact be early grade primary school teachers. They also need to understand the standards which have been used to assess the ECD services from which their pupils have come. Thank you, Mita.
Thank you so much for that, Sheldon, and for raising these important points. Also, related to the changing context that we're now in, and looking at how the standards might need to be adapted and applied. Thank you so much for that. With that, I will go to Mamuda to please make your interventions. Over to you, Mamuda.
Thank you. First of all, I would like to congratulate Rosa for taking this initiative of service quality standard development and ensuring the participation from South Asian countries representatives in this process. We know that most South Asian countries have developed the early learning and development standard for different age stages of early childhood with UNICEF support. So in Bangladesh, we have also developed the ELDS for from childbirth to 8 years old of children and validated the content, and also translated this validation in Bangla for next stage of age validation purpose. So Bangladesh ECD network played a very significant role as technical associate to the early learning for child development project under the Ministry of Women and Children Affairs and UNICEF Finance in this throughout the development, content validation, and translation process. So we know that ELDS would have little value unless they are complemented by a set of ECD service quality standards, so which are really necessary to create a learning environment of pre-primary curriculum, learning environment to promote the attainment and achievement of the desired ELDS outcomes of children. So during the development of our pre-primary curriculum in Bangladesh, we have followed our ELDS for 5 to 6 years old children, and for operationalization by the implementing agencies, these standards used for them and under the primary, and that initiative was under the primary education development program of the government. So this standard also shared in the regional workshop through the representative from UNICEF in Bangladesh. So Bangladesh, meanwhile, Bangladesh government also has been a process to endorse a Daycare Act 2021, to support the child care and development of young children, and also parents, particularly the parents, those are working parents. So this Daycare Act has been approved in the cabinet already, and it is placed in the parliament, and we are just waiting to get the final approval from parliament. So considering the implications of this act on the services providers, the ELCDP is in the process, the government project, of developing a national operational manual on daycare program with technical assistance from BRAC IED, Institute of Educational Development, and Bangladesh ECD Network. So service standards are in mind very much, and keeping the ELs in mind. So I think this is the very good opportunity. This is the right time to think about the adapted service delivery standards of ROSA, how Bangladesh can adapt it. And we know for below 5 years, because we have for pre-primary education 5 to 6 years old children. So this, and of course the adaptation, which we were already raised a question, contextualization, so social and financial, and also the parents' background. There are so many factors for adaptation, so that should be considered. And I think in Bangladesh, after the approval of this Daycare Act, so there will be a detailed implementation operational plan under the leadership of the Ministry of Women and Children Affairs in Bangladesh. And Bangladesh ECD Networks, the chairperson, he is also representing in the government coordination committee. That's a very higher policy level committee. So I think Bangladesh ECD can take an important role to promote these standards through their member organizations in Bangladesh, because after this act approval, there will be the manuals, the standards, and the programs for implementers, for government, because you will be mandated for all the institutions, all the bank, all the service providers. So I just like to thank ROSA and ARNEC for giving this opportunity to raise this question here. It could be a partnership with Bangladesh ECD Network, UNICEF, and ELCDP project under the Ministry of Women and Children Affairs. Thank you.
Thank you so much for that, Mamuda, and really good to hear of this opportunity to promote the standards in the context of Bangladesh and the work that's going on there. I will ask next if Sumitra could kindly make her interventions. And then we'll get to some questions. Yeah.
So first, thanks for the opportunity to ARNEC and UNICEF for having the space to talk about how do these standards even get implemented on the ground after all the design thinking that we've done. At Mobile Crashes, the core ECD model of standards is drawn from the National ECCE Policy Quality Framework. But I can say that much of the standards are similar to the ROSA standards, and within the implementation, the core guiding principles that was presented today in terms of inclusion and equity, in terms of holistic and integrated approach towards quality, a rights-based approach towards quality. These are some of the guiding principles that guides Mobile Crashes in developing and implementing its standards. How do we implement these quality standards? We've looked at it at 3 levels: non-negotiable standards, essential quality standards, and desirable quality standards. Non-negotiable could mean things like basic health and nutrition support to children's supplementary nutrition program, a trained caregiver, safe environment. Essential quality standards could include minimum wages for trained caregivers, appropriate adult-child ratio, state-specific learning curriculum for children. And desirable standards could include things like better infrastructure, better play equipment, and things like that. How do we arrive at grading these standards? How have we arrived so far at grading these standards into these kind of 3 buckets? Something that Vinita ma'am also presented, that a lot of the quality standards have to be contextualized to the settings. We work in some of the most vulnerable situations having working women mostly and their young children, construction sites, tea gardens, brickworks, urban slums, prisons, and places like that. So a lot of renegotiation with the stakeholders, starting from looking at what is the burden on women and children in these communities, to what do parents and families in the community expect and want, to who are the primary service providers or stakeholders. It could be government, it could be employers, it could be companies and other agencies. The whole idea is that to renegotiate the standards, to look at what we are trying to achieve as improved child outcomes, and then develop these, co-create these standards with them. Of course, a lot of discussions on standards, after all the understanding, boils down to what is the fund available to implement these such standards, and these guidelines are framed accordingly. What has MC learned from our experiences of applying these standards? Lots of lessons, but I want to focus on two primary lessons that we have learned. One is that any discussion about standards, implementation, and sustaining the quality of programs according to the benchmark standards, it is impossible to have it without the participation of parents themselves. Parents' awareness about quality provisions, why it is important for them and their children, the community understanding and awareness becomes very critical, and their conversation with the service providers, especially center-based care providers and the team, becomes essential. So the whole idea of decentralized ownership of the standards, understanding of the standards, and their role in supportive supervision and monitoring the quality becomes essential in applying any kind of standards. The second big lessons that we have learned out of maintaining such quality standards is the investment in a trained, qualified, sensitive, and competent supervisory cadre. Whilst a lot of investment goes into the training and the skill building of the frontline teams, it is equally important to invest in a supervisory cadre that creates that both an enabling and an enforcing framework to implement these standards. They enable by handholding and supporting and training the frontline teams in problem solving around quality standards, and they also enforce because then they are competent to monitor such standards. The other important lesson that we've drawn from the supervisory cadre is that whilst we talk about the multi-convergence model of successful ECD programs, it is the supervisory cadre at the ground that really becomes the glue that binds the program together and makes all the necessary linkages with health, nutrition, urban civic amenities, and things like that. So that's an important investment. Finally, what can we do moving forward? What should be considered? I think the one thing that I will say that we need to consider is financing. We spend a lot of time in developing standards and creating awareness and ownership about the standards, but standards need to be backstopped by finance. So I think that is an important criteria, that we cannot look at the nurturing care framework and the quality standards without adequate financing and the cost implications for implementing these standards. And that is something that organizations as mobile crashes alone cannot push for financing and budget implications. It's platforms like ARNEC and UNICEF and other coalitions who can push for the financing discussion around quality standards through evidence, through best practices, and through costing models. Lastly, I would say, picking on what Mamuda said, that without a legal entitlement, quality standards will remain as nice to have and as welfare options as opposed to an entitlement option. In times like COVID, when there is high priority and other survival needs, ECD and ECD quality gets deprioritized quite quickly. So an entitlement approach to enforcing some of these quality standards would also be important as we move forward. Thank you.
Thank you so much for that, Sumitra, and thank you to all of our panelists today. And actually touching upon, and thank you very much for sharing those lessons learned, which are some very important points to bear in mind. And they really, including the point that you mentioned about involving the importance of involving parents as well, and that demand side of all of this as well. I'd like to invite our panelists to please all, turn on your cameras, and we'll do another round of Q&A. and including, and all of them, also Vinita as well. So we can invite all of you. And maybe just to kind of touch on some of the points that Sumitra was talking about, and this is the big question of, how do you operationalize this, with the government? And I wanted to kind of, and I think Mamuda, you talked a little bit about some of that coordination mechanism that's there in Bangladesh, but that's often the big challenge with ECD. And so I wanted to get your insights on, what you would recommend as a good strategy and approach in terms of implementing and monitoring standards such as these, given all the different ministries that would be involved, all the different providers that are involved, where should this be situated within the government? Who needs to be involved? So some of that around the whole governance structure that's required. So an easy question to start with, but posing that to anyone who'd like to take a stab at it.
Would you like me to respond?
Sure, please.
Okay, as you said, it's a very easily most complex question. I think that from whatever I've experienced and read and reviewed in the course of these standards, as well as otherwise, the challenge comes is in terms of the way the verticals are there. The different departments or the different ministries are structured in those verticals where there is very little interface. And to be able to really get that addressed and to be able to get them to think holistically, I think that what is very important is one, that there has to be the highest level of political commitment. And for example, I think in Thailand, we saw when we were reviewing the standards that it is at the level of the Prime Minister or Deputy Prime Minister. So it's somebody at that level who has the necessary authority and clout to be able to bring together the different verticals, to have a common purpose. So one is to have a very high level of political will and chairpersonship to be able to really lead the process. And the other, I think, is that the planning and the monitoring, I think, needs to be done collectively, and implementation needs to be done sectorally, because every sector has their own domain knowledge. So, so that is best done by them. And for that, I think, as Sumitra rightly said, that there is need to have a dedicated budget. And that budget needs to be, again, for each of the different verticals, because once there is a budget allocated, there is accountability also. And there is facility as well to implement. So I think these are some of the things that we need to keep in mind.
Can I just add, Mita? I think one issue is that many of the management information systems, whether it's education or health or others, simply don't look at issues around young children. They don't collect data on early childhood development programs, especially if they're non-governmental, which they are, majority are in many countries. So how do you try to ensure that the individual information systems that you have, first of all, are collecting relevant data, and then, as was just said, somehow analyzed collaboratively as a whole?
Right, thank you so much for that. I don't know if anyone else would like to come in on that. Right, or otherwise I'll go to another question that has been coming up a lot, and we've touched upon it a little bit, and we've talked about the importance of promoting these standards in the current context of COVID-19. And Sheldon, you also raised the point of some of the different ways of working that we have now that this also needs to kind of cover. But one of the questions that's also coming up is, how do we sustain quality of ECD services in the face of the COVID-19 pandemic and all of the challenges that we're facing, and similar, sort of emergency humanitarian sort of contexts. So wondering if we could, get some of your thoughts on some of the strategies that we can, kind of look at in this particular context that we're in. So, to anyone who would like to take this. Yeah.
I'll be short on this. One of the important things is to get governments to realize that the quality has gone down. And that's what Jim talked about at the beginning. The assumption is that we'll just sort of pick up where we left off. When when we open up again. But in fact, early childhood development services, pre-primary subsector is going to suffer the most because it's community funded, family financed, privately run. So we have to get governments to accept the fact that the quality has gone down before we can get them to figure out how to build it back better. And that many governments don't do yet.
I can add to what Sheldon has said. Besides giving them regular evidence of how the quality is going down, real time, on the ground situation right now, one of the things is also to governments want solutions always. They don't want to hear the problems from you. So one of the things is to find, because we are on the ground, to find ways in which early childhood development services can continue to function through the existing health services now, or the citizens' rights provisions right now. How do we link some of the ECD components into the priority government programs and offer them solutions of how these things work? The other thing is that whilst the implementation mechanism is off the ground and families are left to themselves to fend for themselves and their children, a strong, robust parent support program also helps during this time, because when parents are informed, educated, and feel supported and feel that they are facilitated to make those linkages with existing mechanisms, then they are able to demand services even during these difficult times. And that's been our experience through the entire year of continuing to support families to access those entitlements and those services.
Yeah, and I think, I don't know if you see in that an opportunity in the current context to actually engage parents and to create that demand for quality ECD services. Perhaps this is, an opportunity for that.
Although
that we have.
Sorry, I must add that now with the second year of COVID, how much burden are we going to put on the parents? They becoming the primary ECD service holders. So that's putting an additional burden, and we are seeing that regularly now in our communities.
Oh, absolutely.
Yeah, I would like to add one point that I think evidence is also a very important point here, that the quality is going down. So already ARNEC have a survey and different networks, organizations doing different researches and findings for the COVID situation. I mean, how they are suffering, particularly the special needs children. They are not getting any therapy, any center. So considering this, I think we have to show these evidences in front of the policymakers. So in Bangladesh ECD Network, we have just taken some initiative of series of webinar on policy, talk about these things and bring all these issues in front of them. And another thing is, in the COVID situation, all children are at home. So the main issue, how we can build the capacity of parents, the family members. That's the main thing, I think. Yeah. So we have to think the new strategies, how to reach up to the home level.
Thank you for that, Mamuda. And maybe just lastly, I wanted to just, or second to lastly, I just wanted to go back to one point that you made, Sheldon, at the beginning, and I wanted to ask if Vinita also wanted to come in on that in terms of the scope of the standards, where I think you talked a little bit about the kind of center-based focus of the age 3 to 6, but maybe, kind of touching upon the point about the extent to which the standards kind of look at that transition into, to primary education and the whole school readiness aspect, if you'd like to speak to that part.
Yes, so I think in terms of the curricula, essentially the issue here is more curricular. So in terms of the curriculum and the thrust of the curriculum, and not only just providing a good foundation for children, but also being able to develop the necessary school readiness capability, and also to talk about the importance of a good learning environment and relationships, which are very key to the whole aspect of school readiness. Where it falls short, which is very right, and I fully agree with that the standards should have gone into the primary also. And in India today, we have the foundational stage, which is actually incorporating or rather extending the early childhood years on to up to age 8. for up to class 2, grade 2. So, and also committing to have a kind of a continuity of upward continuity of curriculum and pedagogy. So that I think needed to be there. But for whatever reasons, it was decided that we should just take it up to the school entry age. But it would have been good, and maybe it can still be extended to that stage as well, to make it more holistic and, as Sheldon said, ensure the smooth transition. Yeah.
Just a couple of examples on curriculum. There could be a standard related to what extent does the curriculum of pre-primary school flow logically and seamlessly into the grade 1 curriculum? To what extent do the assessment methods and measures in pre-primary actually get transmitted up to grade 1 into early grade teachers? I think those are the kinds of things, if we're looking at what are the standards that we want to assess pre-primary programs with, which help to ensure an easy transition of children into grade 1. And then again, seeing the grade 1 teacher as someone who might also be have an interest in looking at these standards, I think is also an important idea to have.
Thank you so much for that, both Vinita and Sheldon. And that's maybe something, for us to consider kind of moving forward. And maybe last, and this will be kind of a rapid fire question to everyone, just to give your quick thoughts on, what support you think, countries will need to take these kinds of standards forward. So maybe your top of mind, areas of support that you think that countries would need. So anyone can start.
Well, what are the standards that currently exist, and to what extent is there any willingness to actually adapt them or change them? If there's just been a set of standards adopted in some way by a new government, a new ministry, then they're not going to be very willing to look at new ones. But if they're in the process of doing so, trying to assess country by country where they are in terms of developing standards, and therefore see where one can actually intervene with this kind of document, I think is important. Okay,
thank you. Vinita?
Yeah, I think that it is important to help are you saying it, say, for example, from Rosa's point of view, or ARNEC, how they can help the countries? Is that what you meant?
Yeah, it could be ARNEC, it could be us, yeah, or others providing support, for technical support.
I think from that point of view, it is very important to have some
other partners, yeah,
help them come up with, or even to provide them some kind of a broad framework for contextualization, which takes into account the different aspects that need to be considered, and for which would lead on to some kind of a situation analysis for the country, where they are, what is the baseline, and what more needs to be done. So that framework, I think, would be very useful for every country to work upon.
Right. Thank you so much. Yeah, it's a look. Would either Mamuda?
Yeah, I think if I consider the Bangladesh situation, because we are just waiting for ACT, and we have the operational guideline of daycare in the process. Just we have completed the framework. So the process you have developed in this ROSA, I mean, collecting the materials from all the South Asian countries, other neighboring countries, other regions, and different intervention standards. So same process also we can adapt in our country to collect whatever standards we have. I mean, earlier, Save the Children or Pan International, big international organizations have developed. And I think through this network, Bangladeshi City Network, we can convince, we can place these things, the importance at policy level. I mean, this is really needed, because you have ACT right now. We are going to make it mandatory for everyone. So we should have the quality of standards. So already ROSA is here. So why not adapt these things? Yeah, I think Bangladesh is a very suitable and opportune moment. This is, for Bangladesh. Thank you.
That's great to hear. Thank you, Mamuda, for that. And it's great to see that there's this opportunity there in Bangladesh now. And Sumitra, do you have the last word?
Yeah, I think taking on from all the suggestions already given, it's important to have some kind of a political will at the top to get all the multiple players together, looking at what quality ECD can really mean, especially for a country like India. But I would say that, with partners like UNICEF and others, we need to crack the code somewhere to push it to that kind of priority at the top level. And there might be merit in contextualizing and creating a workable implementation model within a particular region of the country or a state of the country, so that that becomes a demonstratable model for the rest of the country or the region to build upon. If we keep pushing it from the top down, we've seen how the pushback we experience. Maybe it's time to go down to the bottom and say that we start at a community level, build it up to a state level, and then look at the national frameworks that way.
Great. So thank you very much to everyone. I think we're coming towards the end of our time, but I would like to thank all of our speakers very much for your time and all of your valuable insights for our session today. And I hope that everyone has found this session useful, and that you'll also find the standards useful in promoting quality ECD services where you are. And as was emphasized, very clearly today, that it is important now more than ever, as we continue to deal with the COVID-19 pandemic, to ensure quality ECD services reach each and every young child and their parents and caregivers, because we simply cannot afford to compromise young children's or compromise on young children's development at this critical stage that we know will impact on the rest of their lives. And as we've talked about here, part of that is, the advocacy that we need to do to get that, political will, that support to promote quality ECD services as we move forward. And these standards were really, developed to serve as a guide of some of the key components of quality in relation to ECD services, in, towards a common vision of what that means, what some of the key principles are, and some of the standards are that we should strive for. And perhaps, looking forward, we can continue to looking at, building on them, taking in the current context, and also kind of expanding on this as we, talked about, to look at the full scope of ECD. And we hope that you will, find this as a, useful resource in your own work, in, either developing similar standards in your own context, and aligning them with your ELDS, your early learning and development standards, as we heard is very important to do, and that you can adapt this to your own context. And for those who already have standards in place, we hope that this can also be a useful reference as you kind of look to update or strengthen your standards, and hope that we can all collectively commit to doing all we can to continue promoting quality early childhood development. So thank you very much to all of you for your time and for taking part in this webinar. And maybe just before everyone goes, there's a few quick reminders, if we could go to the next slide. Just to remind everyone that you can find this recording, the recording of this webinar, as well as Vinita's presentation at the ARNEC website. So do visit the website when you can. And you'll also be receiving a summary report of today's session by email. And that should be coming to you by the end of the week. And again, if we go to the next slide, I think, we'd like to ask you once again to please, if you could take a couple minutes to give us your feedback on this webinar by completing a short survey. And I believe the link is, you'll find the link in the chat box, or otherwise you can scan that QR code to get to the survey. And for those of you who can't stay on and do that now, we will also be sending this link to you to complete the survey afterwards. So thank you very much to everyone, and enjoy the rest of your day and the week. Thank you so much.